Aloha, I'm Brickwood Galuteria. Welcome to Kupuna Power, a show for and about seniors. As always, we display the senior helpline phone number, 768-7700. Today, we return to our war against financial scams. Here in the Aloha State, our kupuna are trusting and caring, which makes them easy prey for crooks bent on getting their money. Once robbed, they're so ashamed and afraid of being labeled incompetent that they don't tell anyone, not even their families. The main tool of these criminals is the phone. Calling victims, the thieves ho'omale male da kupuna, who are often alone and mistake the soothing voice as a friend. Hawaiian Telcom is very aware of the fraud carried out on our seniors through their phone lines and other modes of communication. They have outreach programs to educate kupuna on recognizing crooks over the phone and how to avoid being scammed. To talk to us about Hawaiian Telcom's efforts in educating our kupuna on financial phone scams is Lulu Asato, Corporate Security Specialist, Hawaiian Telcom. Aloha, welcome to Kupuna Power. Happy to have you with us.
Thank you. Thank you for having me.
Well, okay, let's begin at the beginning. Tell us about financial scams on the telephone and how does that work? Start from the top.
Well, unfortunately, it's a huge issue in Hawaii or in the United States.
Sure.
One of our main biggest scams that are targeting the seniors right now is the Jamaican lottery scam.
Oh, yeah.
Somehow they're obtaining a list of names and numbers of senior Americans, and they're calling them in random and posing as the American Sweepstake Company.
Sure.
Saying that they're winning $1 million.
And then you got to send money.
But to get the prize, they have to send money for processing or taxes.
So they're told to go down to someplace and get a money wire or something?
Wire them money. So a lot of them are going to Western Union or wherever be the banks, and they're wiring them thousands of dollars.
So in your business, how did you folks realize that this is a big problem? How long ago? Is it just recently? Because it's been a predatory landscape for a little while now. And then how did you decide that, okay, you're going to put some time into this and develop a hotline or whatever? Tell us the story.
Well, the Nuisance Call Bureau actually was established in 1995 when Hawaiian Telcom had promoted class services. And then we realized that people in Hawaii have a lot of nuisance calls or unwanted calls. So we established a team of trained professionals, and what we do is take incoming calls for anyone within the state that have unwanted nuisance calls.
So a nuisance call could be my friend bugging me. That could be a nuisance call.
Yes.
But on all the way to the kupuna abuse type of calls?
Yes.
Okay, so what's the number to call?
643
643
7111.
643 7111. And what we're going to try and do is we're going to try and find the nexus between the helpline and the hotline, the nuisance hotline. So let us work on that, but we're going to get to that because we want to connect everybody. It's about connecting dots over here. Okay, so I'm a kupuna. I'm going to call. I'm going to get a call. I'm going to receive a call. Now, what do you advise them to do? Once, they may suspect that this call is more than a nuisance. Yeah.
Well, once they call us, that's the biggest step. They call us because they are aware, or their family becomes aware that they possibly was a victim of a possible scam.
If I'm a kupuna and my family calls, they know I'm in trouble. I'm almost addicted to this, maybe kind of, sort of. Do they have the authority to step in and make the call? Or and what if I'm kicking and screaming? How does that work anyway?
Well, they can always call us.
Okay.
Anyone can call us, and we can give them options. Because the main thing is we're trying to educate and make them aware that it's out there and that these scammers prey, unfortunately, on our kupuna because their greatest strength sometimes can be their weakest strength because they care and they're trusting.
Oh, yeah, for sure. Now, what happens then? I'm going to call you, and then what are you going to do? We're going to set up an appointment, and then we'll take a look at the options that we can, with regard to the telephone?
Right, on a case-to-case, and depending on what the issue is, what you have existing on your line at that time, we have various options, from call blocking or getting a trace on your line so we can
really?
identify it.
Okay, so if I got a call coming in from offshore, okay, you can actually block my calls from, totally? And I just give you phone numbers, and then I can only accept the calls from phone numbers that I give you?
Correct. We have we have a lot of options. We have features that we can give to the kupuna or anyone for that fact. From call blocking, like I said, or where we can block a number. If we can identify a natural 10-digit number, we can block it.
Oh, really?
We can have them, many don't want to block numbers. There's options of the caller ID where they can screen it. And so when they see a bad number or a number that they don't recognize, they just don't answer it. Or we can do special call acceptance where we can program only the special numbers that they need to have call them.
Oh, okay.
And anyone else would just get a recording that you're not accepting calls at this time. So there's various options, but we work on it on a case-to-case basis.
You can track these calls. Now, that's fantastic, because there's so many different areas that are hubs for this type of work. I know it's beyond the country, and that becomes, I guess, a jurisdictional issue for the authorities. But you folks are helping in that way. We're trying to connect everybody together, bring the silos down. So what are some of the worst things that you've seen in your time as the, well, you're not the nuisance hotline operator, huh?
No, one of.
One of, huh?
Yes.
And by the way, how many people you got working?
Right now we have three analysts that are trained, experts on assisting customers with the different options or advice.
Sound like you need more, though. I mean, 3 people, that's okay, though. I mean, we appreciate everything that you do. When it comes to utilities, when it comes to Kupuna, do you have anything that goes on the bills or the statements that suggest these things that you're talking about? You do?
Sure. Because the one that I mentioned, the Jamaican, it's a 876 number.
Yeah.
So unfortunately, it looks like a toll-free number.
Yeah.
So a lot of times when they come home and they see they've missed a call, or if they've fallen prey to their victim and they're hooked, and they start trusting these Jamaican calls, they can get addicted. If they see they've missed it, they'll call them back. Unfortunately, even if it's Jamaican, they can get charged a lot of money for calling them, just on the telephone bill, because it's not domestic, it's not within the United States, first of all, and it's not a toll-free number.
Right.
And then once they call them, they're racking up a lot of charges on their bill.
Yeah, yeah.
So that's one way we identify too, or the family members can identify and see all these numbers, and it's unrecognizable.
Yeah, it's right.
Yes.
Right. I know that. A lot of us have gone through that with our kupuna. Our mothers, our fathers, our aunts, our uncles, and they're all they retired as true professionals in their whatever career they had, but they seem to be falling prey to a very sophisticated environment. So in terms of protecting oneself, what do you advise the kupuna instead of, hanging up?
Right.
But we shouldn't divulge of any type of information, if at all. What do we not want to give besides our name?
Well, first of all, we tell them never, ever give out any personal information besides your name, which a lot of times they know it already, is the social security number, your birth date, your maiden name.
Maiden name?
Maiden name. A lot of times they can use your maiden name to access your accounts.
Okay.
Or of course your account numbers,
sure.
Your financial account numbers, or anything that they can pull money out or scam money from you.
I'm so glad that we have people like you in the telephone company, the utilities, and what we're trying to do is we're trying to bring the silos down so that everybody talks to each other. In the last show we had Lieutenant John McCarthy of HPD, and it seems as if there's more dialogue going between the major stakeholders to protect our kupuna. So before we end today, why don't you give us the hotline one more time, the nuisance hotline. And I got some friends that are going to need that nuisance hotline for. But for kupuna, what number do they call?
Well, the Hawaiian Telcom Corporate Security Nuisance Call Bureau is 643-7111.
643-7111.
Right. And we're open Monday through Friday, 8 to 4:30.
Okay, Monday through Friday, 8 to 4:30. And if I got a call during the weekend, can I leave my name or if it's something that is so urgent that I'm going to need to talk to somebody or at least leave a message, can I do that too?
Unfortunately, not at this time. But once you've gotten a call, we've given you an option. Just take the date and time down.
Oh, yeah. Okay.
And then call us the next working morning, and we'll be able to help you.
Well, a lot of our kupuna are diligent in that way, It's almost like they're writing things down in the third person.
Correct.
But that's what they should do and then get back to you.
Yes.
Okay, thank you so much. Mahalo, Lulu. She's helped us recognize those anonymous crooks assaulting kupuna over the phone and telling us how to stop and expose them. This is Kupuna Power. Up next, Kupuna Power talked to John Michael Hall, a national expert on Medicaid policy and home community-based services. But first, why was the YLI Drive-In Theater rumored to be haunted?
HCBS stands for Home and Community-Based Services. It's a movement that started about 30 years ago as growing numbers of families realized that when they had a loved one, whether it was a parent, grandparent, or a child who required long-term care, that there ought not to be only one choice. It ought not to be a situation where if you required long-term care, you had to leave your family and enter an institution and go into a nursing facility. When organizations like the Gallup poll ask Americans year after year after year, if you get to a point in your life where you need long-term care, either because you've become more frail, you've had health problems, or you're in some kind of accident, where do you want to receive that care? 90% of Americans say, I want to receive it at home. And the programs funded by Medicaid, the waivers here in Hawaii, allow people to do that. So what we've been doing here in Honolulu this week is meeting with really the spectrum of service providers and agencies who do that kind of work across the state, on the islands, area agencies on aging, home care agencies, everybody who touches home and community-based services in one way. And we've brought a group of folks from across the country, many of them from the mainland who flew in, who are nationally renowned experts in what's the state of the art. What's the latest thinking? What are the latest successes? What kinds of things are coming down the road that Hawaii should be thinking about? And we've spent 3 days with them sharing that expertise and that knowledge with the folks here in Hawaii so that they can plot a course forward. Well, I mean, Hawaii in many ways has been a pioneer state. It was one of the early states in the country to start delivering home and community-based services in a managed care environment. It's a state that is in the minority that invests its own taxpayer dollars through the Kupuna Care program for services that help people stay at home. And that's a good thing. A lot of states don't have that commitment to its citizens the way Hawaii does. Life is not just about medicine. Life is about all those other things that are part of being in the community. And many of the folks who've been at a conference here today are agencies and organizations that contribute. They do those kinds of things that help people live a full life. I think we need to do a better job of how we make those services part of the mix for people who need long-term care in Hawaii, especially people who are on Medicaid. The biggest driver of long-term care is the cost of nursing facility care. Nursing facility care on the mainland on average costs about $60,000 to $80,000 a year. And even if somebody, even if a couple have been prudent and frugal and have saved up what they think is a nest egg, if one of them has a stroke or has falls or has some other kind of incident that puts them in a hospital and then after discharge from the hospital needing long-term care, you can run through a pretty big nest egg in the blink of an eye when the cost of care is $4,000 or $5,000 or $6,000 or $10,000 a month. In Hawaii, the costs are even higher for long-term care, for nursing facility care. And the island of, in the county of Maui, it's as high as $140,000 or $160,000 a year, twice what it is in some states on the mainland. So the stakes are even higher, because for a lot of people, for the average Hawaiian family, who has that kind of money? Medicare itself only pays for 90 days of skilled nursing care immediately following a hospitalization. And in that sense, whether it's a nursing facility care or care from a home health agency, it's time limited, it's for people who have pretty high needs, and it's not the picture of the average person who needs long-term care services, who we're trying to keep in the community for the long term, for over the long haul. For those folks, it's Medicaid. And yet a lot of people, most citizens, don't really understand that. They think that Medicaid is a program for people who receive welfare benefits or on food stamps. But in fact, if you look at who receives Medicaid, where the dollars get spent, the vast majority of the dollars that we spend in Medicaid this country are helping to keep seniors and adults with disabilities at home who require home and community-based services and nursing care. Even if we have programs that allow people to stay at home, if they're alone on their couch by themselves and isolated, it's not a quality of life that any of us would want. We want people to be able to still see their friends, to go shopping, to go, if they have a hobby, to do that. To even going something as simple as going to the grocery store is part of being in the community. And at the same time, we know that seniors don't suddenly lose their talents and their interests and their capacity to contribute just because they cross a certain age barrier. You don't go from being a vital member of the community to somebody who is a has-been just because you have your 65th birthday. We have lots and lots of people who want to be and have a tremendous amount to offer our local communities as they grow older into their 70s and 80s and even 90s. And so some of the work that we're trying to do is how do we make sure that whether people are retiring and figuring out what do I do next, or as they are planning how they will stimulate their own minds and keep themselves busy, how do they bring those interests and those talents to the community and continue to enrich the community with that when we get to a point where career isn't the dominating force in our lives. We have an ability to branch out and to try new things and to contribute things that we're good at. Somebody who is an accountant can, volunteer or even take a part-time job working as the financial officer for a local nonprofit program. And so what we're trying to do is really message the idea that there's tremendous strength and talent that people have and that can be invested to make our community stronger, and we need to make sure that we recognize that that resides in people who are serving who are over the age of 60. One of the biggest contributor to folks winding up in nursing facilities were avoidable falls. It was like Jane Wood talking the other day about somebody who who slips on a throw rug in their living room and breaks their hip, or somebody who, not an issue you would have to deal with in Hawaii, but somebody who trips on the ice coming out the front step, or somebody who steps on their cat's tail and loses their balance and falls down. And when that happens, particularly for folks who are older, folks who have lost bone density, it often can be catastrophic. You can have somebody who breaks an arm, breaks a collarbone, breaks a hip, and they wind up in the hospital and then in months of therapy. and not infrequently in nursing facilities receiving rehabilitative care. So one of the things that that we've been focusing on is how can we intervene in very low-tech, simple ways to avoid those things that have these catastrophic, life-changing, and costly events. Some of that has to do with sending people into the homes, agencies in this room that do this, and folks who work with the managed long-term care companies who will do an inventory of a house and look for the things that are risks. You know, we probably need to move that hassock over a little bit because where it is right now, you're likely to fall over it. Or let's get rid of that throw rug or something like that that we know could be a problem. You have programs like this here in Hawaii. I visited one out on the island of Kauai a few weeks ago, where we're also trying to work with seniors to help them with balance and muscle tone and strength so that they are more agile, they can keep their balance better, they strengthen their arms and their legs, and so they're less at risk of falling or having an accident. And those programs from the beginning were designed to be evidence-based, which is to say we study them and we attempt over time to prove scientifically that if you have folks come to a class 2 or 3 or 4 days a week and they do exercises for half an hour or 40 minutes, that we can show that it reduces the incidence of people falling. We can show that they go to hospitals and nursing homes less often.
Why was a Waialae drive-in theater rumored to be haunted? The answer is, the drive-in was next to an old graveyard, and for years there were stories of a faceless woman who haunted the woman's bathroom. Up next, Kupuna Power looks at what local companies and agencies are doing to provide assistive technology to allow seniors to live independently. But first, what was a nickname for the old Honolulu Stadium?
Assistive Technology Resource Centers of Hawaii, which was established in 1991 and designated by the state of Hawaii as the Tech Act program on behalf of the U.S. Department of Education in 1996, is here to link individuals and the community with technology that allows people to live independently and to participate fully in the community regardless of their ability. ATRC is a nonprofit and it's funded largely by the federal government through the Assistive Technology Act of 1988. It also receives state funding through grant opportunities. Assistive Technology Resource Centers focuses on technology that is consumer-driven or client-based technology. It's choice. It's not a medical model. So we don't deal in what's called DME or durable medical equipment. It's not by prescription. It's technology that an individual believes will make a difference in their life. It's also driven sometimes by the Department of Education for children in the school system. Parents, caregivers come in to seek out equipment that may be valuable to them as they care for an individual family member. Technology is a wide range, and assistive technology, meaning that it assists the individual, can be something as simple as a telephone that increases the volume, for example, for a person who has a hearing difficulty. So people can come and borrow that equipment from us and try it to see if that's going to work before they would make a purchase. It can be as sophisticated as a computer and the necessary software that if the person has quadriplegia, they can then access everything in their home and they can connect through the world via internet. So it's a wide range of technology from very simple. One of our giveaway gifts is a jar opener. And it can be as sophisticated as someone who absolutely needs access through computer technology. Our title implies we're a resource center, and so we're very fortunate we have an equipment loan bank. and people can borrow equipment. They can borrow it usually up to 6 weeks. We ship throughout the state. They can try the equipment before they decide to make a purchase. In some cases, the technology may be covered by their insurance company. In other cases, they're going to have to make the purchase on their own, but we also provide support for that. But we're not a vendor. We don't sell the product. We will recommend vendors who would carry that product. We have a staff of 7 full-time individuals, and we have about 4 or 5 part-time people, and then we do a lot of subcontract work because people come in and they need to be trained in the use of the technology. We also work with employers helping people who need workplace accommodation. We'll go in and do an assessment for workplace evaluation, and again, sometimes lend the equipment so that the employer can, with the employee, make a decision about what would be appropriate to keep the person in the workplace. Technology is across the board. All of us use technology. It used to be that we thought technology was designed for a sick person or someone who was aged or someone who had a disability, the elderly, but now we're all technology users. So almost all the technology is applicable across the board. When the smartphone was invented, there was no intention that it was going to really focus on persons with disabilities or the aging population, and yet the significance of what smartphones has done, we can even see as medical models of being able to monitor. I don't have my Fitbit on today, but it monitors all kinds of information that I can then share with my physician, for example. So it's across the board, all ages. When ATRC first established itself in Hawaii in 1991, we had very simple pieces of technology that we showed people. I'm a big fan of Steve Jobs of Apple, and Steve Jobs did not plan to impact the community of persons with disabilities or the aging population. He really saw, I believe, a business model. On the other hand, the most exciting things are that technology is inexpensive, it's easily learned, and it's popular to carry with you. So people who really benefit more from the technology are now willing to carry that technology with them. It's not a medical model. It doesn't look like you have a disability, or it doesn't look like your doctor prescribed it. It looks like everybody else. So that's one of the most exciting, cutting edge parts of it. We all want the technology, regardless of ability. This morning, we really wanted to focus on the business community, the human resources component, the ability, number one, for those employees who have to take care of someone in their family who is aging or has other health problems. We wanted to focus on how do you keep an individual in the workforce while at the same time allowing them the ability to take care of that individual remotely. So we focused on that.
What was the nickname for the old Honolulu Stadium? The answer is Termite Palace. There you have it. Remember, if someone calls you over the phone and tells you that you've won the lottery, it is too good to be true. Hang up. Call 911. I'm Brickwood Galuteria. Join me next week for another episode of Kupuna Power. Aloha.